Good afternoon, everyone. Thank you so much for joining us for today's webinar on the Youth Protector Factor Study. So before we begin, I wanted to just let you know some house rules and some information. So we are recording today's webinar. It will be available on the CSG Justice Center website, as well as the slides after today's recording. And with that, during the presentation, if at any time you have a question, please feel free to put your questions into the Q&A box. Some of them I'll be able to answer throughout the presentation, and others we will hold until the end of the presentation and take as many questions as we can from you all. And if there are any questions that are unanswered, we'll try to get to those via email with you all directly after the presentation. So thank you to all of our presenters that are on the call today. And I hope that you all have a wonderful presentation. And with that, I will pass it to Josh. Thank you.
Thanks, Keisha. Good afternoon, everyone. Thank you for your time. Excited that you're with us to learn about the Youth Protective Factor Study. This is really the first public release and information about this unprecedented multi-year study. I'm Josh Weber. I oversee the Juvenile Justice Program at the Council of State Governments Justice Center. And pleased to be joined by my co-investigators on the study, Dr. Gina Vincent, who is a professor of law in the psychiatry program at the UMass Chan Medical School, and Dr. Jennifer Skeem, who is a professor at the University of California at Berkeley. Also want to give thanks to our research team that spanned all three of our organizations and who have worked tirelessly over the past couple of years, including in the middle of a pandemic when this research project started to get us where we are today. Just a little bit about the Justice Center for those of you who are unfamiliar with us. Council of State Governments Justice Center, we're a national nonprofit, nonpartisan organization. We work across all branches of state government as well as local government to help states and counties adopt evidence-based, consensus-based strategies to improve outcomes for youth and adults in the justice system. In terms of our youth justice and youth-related work, which I oversee, I've been with the Justice Center for 11 years, and during that time, we've worked with the majority of states all across the country, helping to improve outcomes for millions of young people and their families in the juvenile justice system and related systems across the country. So we're going to do a couple things today on the webinar. First, want to place the Youth Protective Factor study in context and talk a little bit about why the findings from this study are so important and the implications that they can have for juvenile justice systems, state policymakers, other agencies across the country. And then our two research investigators are going to share a little bit more about the study and how the study worked in the states that we worked with, what we learned from conducting the study, and then share some of our initial findings from our first set of analyses and the brief that we recently released, and then also talk about what's to come in terms of future analysis and findings. I think it's important to place this study in context because I think it's fair to say in the 25 years that I've been doing this work, this is the most challenging time that I've seen for juvenile justice systems and really the challenge of improving public safety and outcomes for young people more generally. As I'm sure many of you are experiencing in your states and communities, one of those challenges is real pushback on juvenile justice reforms of the last 2 decades, a spike in concerns around youth crime, around youth violence, really to levels not seen since the mid-90s. Many states enacting more tough on crime policies to arrest and detain and incarcerate more young people, really making it more challenging than ever for juvenile justice systems to remain committed to research-based policies and practices. It's important to say, based on the most recent data analysis that we conducted, that actually youth violence overall compared to historical trends based on the most recent 2022 data is actually quite low. It's 54% lower overall than it was 20 to 25 years ago. But what really was impacted by the pandemic is a spike in homicide offenses committed by young people, a spike in weapons offenses. And so now homicide and suicide are the leading causes of death among children and young adults, particularly due to gun violence and particularly among young people of color. Much of that youth violence is peer-to-peer violence, with half of all offenses that are committed by violent offenses committed by young people. The victim is also a young person, and disproportionately impacting young people of color, particularly Black youth, 20 times more likely than white youth to experience firearm victimization. At the same time, most juvenile justice systems continue to not focus primarily on those higher risk kids. Actually, based on the most recent data, 70% of all kids who are arrested nationwide have not committed an offense that caused direct harm to direct physical harm to another person. And that's important because we know consistently from the research that juvenile justice system involvement is generally not a good thing for kids. Research has consistently shown, including this research, which is from the Crossroads study, that basically compared two groups of similar young people, those who were formally processed by the juvenile justice system and those who weren't. Shows that those young people who became formally involved in the system were more likely to be rearrested and incarcerated, more likely to engage in violence, less likely to complete high school, and generally had worse outcomes. So it's really important that public systems are judicious about the use of the juvenile justice system and are thinking strategically about supervision and service decisions. That's also really important because adolescent challenges with their mental health and trauma have also really spiked. This happened prior to the pandemic, but has been accelerated by the pandemic. Up to a third of all high school students in 2023, based on CDC data, reported that their mental health was not good most of the time or always. 40% of all high school students said that they felt consistently sad or hopeless, compared to 26% in 2009. 1 out of every 5 high school students said that they seriously considered attempting suicide. And during the pandemic, drug overdose deaths increased by almost 110% and remain elevated today. And public systems are really struggling to address all of these challenges. We did a survey of juvenile justice systems all across the country around their staffing challenges last year. 85% said they experienced moderate or severe challenges in hiring and retaining staff, with the majority saying those staffing challenges were the most acute they've experienced in the last decade. Over 80% reported moderate to severe staffing challenges amongst their service providers, and less than 10% of all the survey respondents felt that their state actually had a plan to address these staffing challenges. So the importance of this youth protective factor study and its findings are that given these challenges, juvenile justice systems, related youth and family service systems have to be more judicious, more strategic than ever before about making supervision, service, and resource allocation decisions. And that includes matching youth to the most appropriate level and type of supervision and services based on their risks, needs, and their strengths, which is a key focus of this study. Being very strategic about financial resources and staffing resources that are used for programs and services, and what actually gets you the most bang for the buck in terms of improved public safety and youth outcomes, and really focusing on collecting and analyzing the data necessary to make effective decisions that will include and focus on public safety and youth outcomes. So with that, I'll turn to Dr. Vincent to tell us a little bit more about the study itself.
You're muted.
Thank you. Hello, everybody, and welcome. Thank you for coming today. I just want to mention very quickly, since it didn't make it on the front slide, that in addition to being in the law and psychiatry program, I'm also a faculty in our Implementation Science Advances and Research Practices Center, iSpark, at UMass Chan. I wanted to make sure I gave them a shout out. And I'll just start by giving a brief overview of our methods. This is a pretty intensive study. And Josh, that was a terrific overview of what's going on in juvenile justice today. Thank you for that. So we recognized as investigators, the three of us working together, that, and those of you who are with us who are from juvenile justice agencies or who work with juvenile justice agencies, I'm sure are aware that there are lots of recommendations and suggestions coming at juvenile justice agencies around how they should do supervision, how they should make disposition decisions, what evidence-based practices, what services to give, what best practices to use, who to supervise, who not to supervise. And there's a lot of recommendations coming in. Some of them are occasionally inconsistent. The goal, given limited resources that everyone sort of has right now, was to utilize this study to help weed through all of those suggestions that juvenile justice agencies are getting constantly and pick out what is really the optimal risk factors to pay attention to and the optimal protective factors to pay attention to. So and what services are going to give you the biggest bang for your buck, essentially. So the frameworks that we were looking at are, of course, risk need responsivity, which I am assuming most people on this webinar are familiar with. It's well ingrained in legal settings, criminal legal settings, and juvenile justice settings today. And we know that the way risk need responsivity works is that we use a risk assessment to identify which youth we should be paying the most attention to. And that risk needs assessment should also be giving us a sense of what risk factors are present for this youth that are changeable and can become good targets for intervention or services. So those risk assessments help us prioritize. We want to match services to kids' needs, and that will hopefully reduce recidivism. In contrast, we now have the positive youth development, also referred to as a positive youth justice approach, when we're talking about it specifically in these settings, which talks about the importance of kind of just making sure all youth have a certain type of an opportunity and advantage, and that's going to help reduce recidivism. And the kind of opportunities and advantages that we're talking about here is activities that are going to increase their social support, their social skills and social supports, leadership skills, work and educational skills, and a sense of belonging. The idea from the positive youth development framework is that, which has become increased dramatically in popularity, it doesn't really get into how to individualize this. The concept is not to individualize it. The concept is that all youth will benefit from these types of services, and that will help reduce recidivism. There's not as much guidance around this philosophy or framework and how to implement it. And so part of the issue with this study was to look into what protective factors might be most important. Josh, you can click. The other issue is that these two frameworks, according to some individuals, seem to be in competition. Like one is saying focus on risk needs that should be rehabilitated or improved, and the other says no, just give all youth a certain types of supports and services, and that's going to help them succeed. So are these really in competition, or can they be well integrated to help juvenile justice agencies around their case planning and supervision approach? Next slide. So we had 3 goals for this study, 3 primary goals. One is that we wanted to figure out what risk and protective factors are really most strongly related to recidivism. Those may be the ones that are most important to target. Second, we wanted to see what types of services are most strongly related to reductions in recidivism. Strengths-based services as suggested by the positive youth development framework, or risk reduction services as suggested by R&R. This is a robust recidivism study. And we were looking at recidivism, particularly violent recidivism, which is what we're most interested in, 2 years after supervision or juvenile justice involvement. So we think that what's most important is when they're done with these agencies, what are they doing? Our second goal was to build data tracking capacity with all of these state partners to help them accurately measure recidivism in a robust way and success. And also, one of the challenges of really testing which services are going to be most effective is that a lot of strengths-based services in particular are not documented anywhere. This is not the kind of information that most juvenile justice agencies are going to bother entering into their system because they often aren't paying for them. They're often not in the conditions that youth are receiving from the court, and they just tend not to be anywhere. So it makes it very hard to study this framework and which of these services are most important. Lastly, we're also interested in development. The youth system can span age 10 in some states, maybe even younger in some states, to up to age 22, 23, depending on what state you're in. That's a broad developmental, that covers multiple developmental stages. And there's a lot of reason to believe, based on the developmental pathology literature, psychopathology literature, that different risk factors and different protective factors are going to matter more at different within different age groups. And so we have that question as well, because supervision may need to be modified or may be more beneficial if it's modified by age. Next slide. We really want to thank our state partners who did a lot of work with us on this study. We had 3 states in particular: Pennsylvania, Wisconsin, and Virginia. Each of these states had 5 jurisdictions that participated in the study. We picked the jurisdictions who are most likely to have and be maintaining service data and have good quality risk needs assessment data, and who also were interested in implementing protective factor measure. What we asked each of them to do was to implement a protective factor measure, which was a self-report inventory that youth completed around the same time they received a risk assessment. So all youth who were eligible should have received this either at probation intake, so this is, pre-adjudication, or post-adjudication predisposition, depending on the state's policies. And we had 4 protective factor domains that we were measuring, and those were the ones that we thought were going to be most promising with respect to recidivism reduction. Second, the states were all asked to increase their data capacity around services. And that meant entering everything the youth is doing, pretty much everything the youth is doing. And I'm going to talk a bit more about that in a minute. So next slide. Back to the other slide. Thank you, Josh. All right, so the key lessons that we learned here before we get into the results is, one, I'm going to say working with state partners is absolutely fantastic. As a researcher, it's ensuring that whatever work you're doing is going to be more beneficial for the field at large. And I will also say it's very gratifying. I'll say that on behalf of the 3 of us, that it's very gratifying to be working with a state to help system enhancements and system improvements that they're interested in. We also have to recognize that states have on-the-ground pressures that are real, and be mindful of that as researchers. I'll also say that timing matters. We were very lucky because each of these states that we approached were already in the process of enhancing their service data tracking system, because they had already recognized that they needed a more robust system to be able to evaluate what's working and what's not. And so the stars just aligned for us to really come in and help them with that. So that was one lesson. A couple of other lessons we also learned from trying to implement protective factor surveys or work with these probation offices to implement protective factor surveys of youth. We thought that would be fun for youth. We thought they'd want to do that. And we also were doing this in the wake of people recovering from the COVID shutdown. So we had to come up with creative ways of doing this because kids weren't necessarily going to the offices. We learned that kids don't like completing surveys on their phones or on tablets or on computers, and that really just the old-fashioned way of paper and pencil is the best way to do this. So there were a lot of struggles and bumps in the road with us and probation officers around figuring all of that out. Lastly, and I think most importantly, any probation officers on this webinar will already know this, probation officers and probation offices do not have a lot of time for entering services. Probation offices that have a quality assurance department are well resourced to do this, but most probation offices don't have that. It is time consuming to have a system where you're entering all of this. And next slide. We also learned that service data quality at baseline, looking at administrative data, and this is probably, I imagine, true of many states, at baseline, the quality is not high. The reason for that is because they're entering services that they sort of have to. And so I'm just going to show you data from 2 of our states, because one of our states wasn't entering service data at all before getting involved in this study. We helped them put together a method for doing that once the study started. For the other 2, this is the service data that they entered before and after our intervention, where we train their staff what to consider services. We asked them to enter services that kids were receiving in placements, which is a lot. Any strengths-based services kids are getting, whether it's from school or other venues besides juvenile justice, and any mental health services, and of course their risk reduction services. So this is a very robust data set that we have now. As you can see, before and after the study in the first state, the amount of services that were being entered were dramatic. This is not having any new service intervention. This is simply a result of increasing their service tracking data capacity. In state 2, it looks like their service data tracking went down, but actually the number of youth coming into the system also went down. So next click, Josh. So if you see the number of services that were being entered per youth after the study started, it's dramatically increased from the number of services that were being entered per youth before the study started. The ratio more than doubled. And in fact, in the first state, I can't do math. I think it quadrupled. Next click, please. Another important aspect of this is that strengths-based services really were not getting entered at all before the study. That's probably very common across the nation and makes it very difficult to really test aspects of the positive youth development model. So there was a big increase there, but you can see there's a big increase in all types of service data entry. All right, next slide. I'm going to get into the results and some of the most striking findings from our analysis. And this is all, as Josh mentioned, this is also all reported in our first brief, which is on our website at UMass Chan Medical School. And I think it's on all of our websites, actually, or at least there's a link to it. I want to say from the outset that the first half of this study was focused on retrospective data. What that means is we got 3 years of youth. We got 3 years of data from youth who came into these systems in 2 of these states prior to the study taking place. Now, protective factor surveys were not in place then, and the robust service data tracking that we implemented with these states also was not in place then. In this retrospective data set, which is all that we're reporting today, except Jen is going to give you a teaser about our protective factor results when we get to her. And this is primarily looking at risk factors, recidivism rates, and risk levels of youth, because that's what we had in the 3 years prior to the study starting. I will also say that the outcome that we measured was violent recidivism, again, 2 years after youth were done with the juvenile justice system. And in fact, on average, our average follow-up time was 2.5 years after juvenile justice involvement. Next slide. We have 3 primary findings that we're going to go through with you today. So first, How worried should we be about young people's risk of violent reoffending? Josh mentioned homicide rates are going up. I've seen other data indicating violence is going up, but it's still nowhere near what it was in the 90s. It's very slight, and it depends on where you are to some extent. How worried should we be? Well, there's 3 points that we want to make here. First of all, most youth in these states were not classified as high risk. Only 5% in state 1 and 22% in state 2. Now, when you look at these numbers, I need to explain something. That doesn't mean that state 2 had a lot more high-risk kids necessarily. State 1 administered their risk needs assessment for all youth who were referred into the system. So we're talking about a different population. We're talking about many of these kids got diverted out of the system and were never adjudicated in state 1. In state 2, their risk assessment was administered post-adjudication. And so this 22% of high-risk youth is representative of kids who have already been adjudicated. So we have very different time points here. So I wouldn't compare the states. That's why we didn't merge data across the states. But regardless, you see, we're not talking about high rates of high-risk kids coming into the system. Second, the recidivism rates overall for violent reoffending over more than 2 years post supervision were not high. So in state 1, only 7% of their youth recidivated violently during that very long time period. And in state 2, it was 16%. Again, we expect it to be higher in state 2 because they were dealing with a higher risk sample from the outset. So we're not talking about a lot of youth who are recidivating violently.
And Gina, can you share how we defined violence?
So violence in this study, we were using the definitions put forth by the MacArthur violence risk study, and that many of us use in research, which is persons offenses. That includes simple assault. And the majority of these violent offenses here, actually, the majority of violent offenses in both states actually were simple assaults. Includes simple assault all the way up to murder. And sex offenses that are major sex offenses. Is that good? Did I miss anything important, Jen? I think that covers.
No.
Okay. Thanks, Josh. So a third point is that risk assessment matters and risk level matters. So anyone who's looking to throw out their risk assessment, please don't. It matters because we could tell, clearly you can tell from this chart, if you look at the red bars, the high-risk youth were much more likely to recidivate violently than low-risk youth. So low-risk youth, regardless of the state, we're looking at less than 10% with a violent recidivism rate. And again, the violent recidivism could have been just one simple assault. And the higher risk youth are doing more, and the moderate risk youth, of course, are always in the middle, which is exactly how it should look. I will also mention that the 2 states differed in terms of the risk assessment instrument they were using, but they were both using validated risk assessment instruments, and both of them had significant predictive accuracy for recidivism. And lastly, I'll say violent recidivism. This is on the slide, but I should mention that we also define violent recidivism based on new petitions or complaints. So this was not based on conviction data. The reason for that is that, and I know that there's some controversy around what's the best marker to use when you're determining what is recidivism. The reason we went with petition and complaint is that it allowed us to discard a lot of charges that were dismissed and didn't elevate to that stage. Of course, other charges may have been dismissed or are not adjudicated even after petition. But 2, timing of recidivism is critically important when you're doing research like this. We do survival analyses because everyone has a different length of opportunity to reoffend, and we need to get our outcome variable to be as close as to the time the event actually occurred as possible. When we use conviction data or adjudication data, in some states, the processing time to get to adjudication is averaging 9 months. And at that point, it's been much further out from when the event actually occurred. We also know higher risk kids, not only are they more likely to commit violent recidivism, they're also more likely to do that faster. So that's why we went with petition or complaint instead of conviction data. Okay, next slide. Our second question has to do with, are systems targeting the right youth for supervision? So a substantial percentage of youth in both states, a fairly decent percentage of youth in both states still were low risk. We should mention that kids that are getting referred to the juvenile justice system, a lot of them still seem to be low risk, right? If you look at the beginning of supervision columns in these tables, you'll see that in state 1, 57% of the youth referred to a probation intake, which means they were referred to the court, were low risk. That's a large percentage. Now, this state actually ended up diverting a lot of them. A lot of them just got counsel and closed. So that doesn't mean that the state took them on for supervision. What it means is still a lot of low risk kids are getting referred. We're getting referred, at least. The sample was from 2015 to 2018. In state 2, it's closer to 30%, again, because we're talking about kids that were already adjudicated at this point, so it's lower there. But those are still fairly significant numbers of low-risk kids getting somewhat involved with the system. I'll also show that the risk levels decreased dramatically and significantly in the first state after juvenile justice involvement, regardless of the extent of their juvenile justice involvement. These youth all had a minimum of 1 week being managed by the juvenile justice office, even if it didn't involve any services and it just involved a little bit of monitoring. They all had at least 1 week of involvement there. And you can see a dramatic increase in the number of kids who were low risk by the time they were done with the system, which is terrific. That's what we want to see. In state 2, there wasn't as much movement on risk levels. And so there may be something different about the way these 2 states are operating that is leading to that effect. We can't do that. We can't quite figure that out because this wasn't an experiment. And we don't have good service data to look at whether it had something to do with service to need matching. And I'm going to turn it over to Jen, who's going to give a little more information about whether the right youth are being supervised.
Great, thanks, Gina. Josh, we can go to the next slide. Thank you. All right, the third question that we asked in this retrospective study, so this is the one that uses data from the past to look at some of these issues, is really which risk factors are the most important ones when we're considering whether violence happens after system involvement. And the take-home message here is that the risk factors that you find most often among this pool of youth in both states are not the ones that necessarily are the most important ones to focus on if what you're trying to do is prevent violent reoffending. I want to say before getting into the specifics here that risk assessment tools in this study worked. So most of the risk factors that were included in either one of these tools in each state were predictive of reoffending, but we're really interested in trying to the extent that we can, figure out which ones are a bit more important when it comes to identifying the kids who are going to continue having serious problems after system involvement. So the most prevalent problems appear over here on the left. They vary a bit by state, but the most common problems among these youth coming into the system in both states were substance abuse, poor use of leisure time, which means lots of unstructured or unsupervised time, and to a lesser extent, school problems. They could be behavioral, they could be academic. Only one of those, school problems, emerged in the set of relatively strong risk factors for violent reoffending. We also found that family problems strongly predicted violence, which, signifies how important families really are, given that these are youth. Finally, spending time with peers who engage in risky or delinquent behavior was also a pretty important or strong risk factor for violent reoffending. So those are all contextual factors that matter for kids, right? So what's going on at school, what's happening in the family, and maybe even more importantly, who are they spending time with and how risky is their behavior? The rest of the strongest predictors in this study were individual factors. So factors in the individual or the kid. Factors like attitudes that are supportive of crime and antisocial features like anger control problems or impulsivity or problems controlling behavior. So those are individual factors. To put this in context, these findings overlap with past research, including some adult research on what they call the big four risk factors for recidivism. The strongest risk factors often are those that are most directly tied to antisocial behavior. So attitudes and traits supportive of crime, delinquent peers, etc. What does this mean? It means that agencies could prioritize services like cognitive behavioral therapy for these kinds of individual features that can address these issues. Those are services that we don't find that often out there in the world, but could be really important if what we're interested in is preventing violent reoffending for some of our higher risk youth. At the same time, these are youth, and I don't want to gloss over the fact that problems in the family and school and peers are also important risk factors to continue targeting, and in many ways are unique to young people. Next slide.
Jen, if I can just briefly add, we tease this out in the brief, but I think it's important just to add to what Jen said in terms of implications for probation agencies as well as courts. This data really emphasizes the importance of an individualized approach, that it can be very easy for probation officers or courts who get used to seeing lots of kids to just focus on the things that are most common, to focus on the things that are most easily observable. We know that probation conditions often focus on things like drug testing or getting, kids involved in pro-social activities, so they have better use of their leisure time. But this data reinforces that those are often not the strongest predictors of reoffending, and particularly the most serious kind of reoffending that systems are particularly concerned about. And so this really just emphasizes the need for risk assessment, quality assurance, individualized approaches to case planning, more individualized approaches to probation conditions, but just really focusing on the risk factors that matter, as opposed to just general approaches that treat all kids the same.
Thank you. Yes, and again, having some of those individual services that can be more rare in agencies can be important for a subgroup of youth that are important. All right, so with that is a beautiful transition to the next point, which is that one size does not fit all. One of the most important things to pay attention to, beyond just which risk factors are actually maintaining problems for this particular youth, one of the other things that's really important to pay attention to at the whole agency level is being able to provide developmentally sensitive services and even assessments that really pay attention to the developmental stage of kids. So we found in this study, one of the most exciting and innovative findings is that age matters. So substance abuse, you'll recall, was among the list of not so strong risk factors, even though it was very common among the whole pool of youth. The predictive power of substance abuse depends on kids' age in this study, or their developmental stage. And I'll give you a preview of our prospective study, the next and most exciting one. We replicate this finding. So it seems to be a true signal that substance abuse is a stronger sign of a problem, in this case, recidivism risk for violent offending after supervision for early adolescents, kids who are really young compared to their older counterparts. Substance abuse is more unusual among the really young kids compared to the relatively older counterparts, and it probably signals that there are more of a problem. So you can see here in this graph, it kind of plots substance use risk scores here on the x-axis by the likelihood of having any petition in this case. So it's any petition rather than a violent petition. And what you can see is that the line is steeper for early adolescents. What that means is as their scores on substance abuse get higher, their likelihood of having a petition gets a lot higher. It increases by threefold for the early adolescents. Compared to the late adolescents who are over 18, there's almost no difference. This is almost a flat line. If you look at no substance abuse problems, it's 24%. Compared to the worst substance abuse problems, it's 33%. So this is all to say that age and development matter and are important things for agencies to really take into account. So jurisdictions could prioritize effective substance abuse services and interventions for their youngest kids in particular. It'll be important for some of the older kids, but for our whole group, again, if you recall our earlier slide, this is not a major risk factor until we break it down by subgroups. Next slide.
Can I just make a quick point there that I think before Josh does, because he's probably going to say the same thing, but just that there's still a fair bit of emphasis in some jurisdictions on restrictions around drinking and marijuana, which is becoming legal in many states. And this is still probably a big reason that kids get violated. And so putting these restrictions and conditions on the older kids where it may be more normative behavior and not tied to recidivism is something that we would just suggest be really strongly considered to not do. Okay. Thanks, Jen.
Mm-hmm. All right, so the best is yet to come, is what I would say. We've learned a lot of exciting things from the retrospective study, again, the study that looks back at the data that agencies had to try to understand how worried we should be, whether the risk principle is being followed in any observable way, and which risk factors seem to be most important. But we're really moving into the future in this prospective study where we actually assessed kids. We introduced these protective factors to measure things that typically aren't measured in juvenile justice and start to ask some questions about what kind of value might a strengths-based approach add. So we're going to address three major questions in our prospective study. Again, this is the one where we've got the validated measures of strengths that we can add to the risk measures in all three states. We're also measuring services a lot better in this study or at all compared to the retrospective study. And then we follow youth over time to see what matters and how well the system is responding to their needs. So the first question that is really exciting is just which protective factors matter most when we're talking about assessment and also providing targeted services in the juvenile justice system. We measured, I'm going to give you a little taste of our preliminary results from one state so far. In this study, we took a really deliberate approach to choosing protective factor domains that seemed to really matter, that weren't just the opposite of risk, that weren't just, something that's going okay, but actually something that is meaningfully different, like a construct that has probably some unique value. So I'm going to tell you what the domains are briefly and then share with you what we found for one state. So the protective factor domains that we examined are pro-social identity. So this is really the extent to which somebody views their future possible self as pro-social, caring, compassionate, kind, honest, hardworking, etc. We used validated measures of a moral ideal self and how much that is internalized. That was the first domain. It's about identity, how you think about your future self. The second domain was about pro-social engagements. So how engaged in educational, employment, or community pursuits are youth? How connected are they or bonded to their school? How much sense of social responsibility do they have? Like their attitude about young people's volunteering or caring about politics? Like this is in kind of the civic engagement space. And finally, this is a big deal for young people, purpose. What is their sense of purpose? Do they have a sense of purposeful life goals and career pursuits? Like this is, as some people have said, mattering really matters during adolescence. So purpose is important. The last couple of domains are ones that you would predict. So one is about social supports. So supportive bonded relationships with peers, and also having like actual supportive caregiver relationships. The last domain is self-control and self-efficacy. So how able are you to control your emotional and behavioral impulses, and how much do you believe in your ability to handle life's difficulties? So those were the 4 domains that we've measured. We've looked at one state, and the first and exciting thing to share with you is that they all matter. They all protect against or inversely predict reoffending in some way. And also, a bunch of them add value to risk factors. So even after we're considering risk scores and the stuff that we're already assessing, we find that some of these still add value and help tell us who's less likely to reoffend, even after we've considered their risk level. So pro-social engagements, self-control, and social support, especially from caregivers, seem to be especially important in protecting against violent reoffending after supervision. And again, they do so after accounting for risk. So that's the first question we're looking at. We have 2 more states to fold into this, but we're excited about the preliminary results. We're excited because this gives agencies a signal about what would be useful to assess and what kind of services or supports might help build those particular strengths. That gets us to the second major question that we're asking in the protective factors study, and that is whether strengths-based services add value to risk-based services. So these are the services that are trying to build strengths, promote pro-social engagements, etc., rather than reduce deficits or risk. We took a lot of care in this study with nationally renowned experts to classify services as those that are mostly strengths-based versus risk-based versus some blend of the two. So we had Mark Lipsey and Jeffrey Butts help us classify everything, and we're going to be looking at whether and how each class of services protects against future reoffending. We're going to do our best to use statistics to model an experiment here. The last question, which is also super exciting and innovative, is how should we think about adapting our services and supervisions based on where young people are developmentally? We've already given you a preview that substance abuse is one example where we should probably be more concerned and prioritize good, effective prevention and intervention early on. There are other signals that we're already seeing in our first prospective state analysis that reinforce what we've seen for the risk factors, and also tell us that some of the protective factors matter more depending on kids' developmental stage too. And again, it's just one little teaser. We are seeing in our first state that this sense of pro-social self may be particularly important for some of our older adolescents compared to their younger counterparts. So that's where we're going. We're really excited to share with you the results in our next brief. I'm going to stop there and hand it back to Josh.
Thank you, Jen and Gina. Seems like we've got a bunch of questions. We appreciate everyone's interest. Keisha, if you want to go through some of those questions.
Absolutely. Okay. So apologize in advance. We have so many. We'll get through as many as we can. So the first one, it says juvenile unit supervisors and law enforcement agencies play a pivotal role in deciding whether or not a youth is prosecuted or diverted. How involved were they in this study? And do you know if they have access to training that provides them with information like this study?
I'll take that. All right, so yeah, that's your point's very well taken. So this particular study, we were dealing just with the juvenile justice agencies at the state level or whatever kind of centralized body they had that they worked with, and the probation offices. Because they're the ones providing the data, and we're not actually doing any sort of intervention here. We're really just getting the data to figure out how can we then advise states around where to target supervision, which kids, what services, what risk factors, and so on. The idea is that within the next couple of months, we go back to these states and we give them information from our findings and specific recommendations. And at that point, we would be engaging the DAs at the very least. We haven't talked about law enforcement, but I think that that's a great idea. So that our information would be fed back to them in helping them devise a state plan around this, around the findings.
And I'll just add to that, it is a really important point. It's something that we're really emphasizing as we work with states and communities, is that, to be frank, too many low-risk kids are getting arrested and into the juvenile justice system in the first place. And as Gina noted, many of those kids might not get on formal supervision, but we know there are negative collateral consequences for kids just by getting arrested or just by getting referred to court. So an important part of not necessarily the study, but this work is, as Gina mentioned, really partnering with the 3 states, sharing their full data with them and other stakeholders, and getting them to think about a statewide action plan that includes how to improve their supervision and service decisions.
Thank you both. Another question, was education evaluated as a risk factor? Most youth are very far behind academically, and this is often overlooked as a significant risk factor. Just curious if this was calculated or evaluated at all within the study.
Yeah. Jen, you want to so education, yes, education was measured in both of the risk needs assessment instruments that were used in these states. So one of them used the YLS-CMI, the other used the YAZI, and that's always part of any risk assessment instrument. When we said behavioral problems in school was one of the most common risk factors, that's because the YLS measures education really based on what kinds of problems is the kid getting into in school. Are they being truant? Are they having problems with teachers, with peers? Have they been kicked out? And that sort of thing. The other instrument does measure academic performance to some extent, and both of them measure, whether kids are underperforming for their capacity. And so, yeah, that's considered as a risk factor. And that was one of the risk factors that came up as one of the most predictive too in Jen's slide.
Jen, did you want to add anything?
No, that covered it. I think that's one of the reasons why we wanted to distinguish between risk factors that are most common, like lots of kids have problems academically, and those that are most predictive, which may or may not feature academic problems for a given youth.
Yeah, I think we should just quickly say the measurement that we're looking at here is recidivism. We know that there are other outcomes like education outcomes that matter. You know, and obviously part of studying protective factors is those might have benefits by improving those in and among themselves. But given that this is a juvenile justice study, really a focus on recidivism and particularly violent reoffending.
I'll also just add to that really quickly that one of our states did have good baseline data, and we were able to gather good baseline data on educational status, work status, and a couple of other protective factors or strengths. And we have it at baseline and at the end. So we do have those positive outcomes in one state. We just haven't analyzed it yet. Yeah. So it's not just recidivism for all of them.
Thank you. Another question, how do you get parents to engage and make sure CBT or other therapy is followed?
Yeah, that's a good question, probably beyond the exact scope of this study. But I think one important thing to point out that this study relates to that question is actually having data that tracks service participation, but not just whether kids were referred to services, but what kind of duration of services they actually got. Did they successfully complete the program? A lot of jurisdictions just don't even have that basic data to know whether kids and families even participated in the service at all, let alone that it was effective. So could certainly have an entire other webinar about kind of engagement challenges and service access challenges. But in terms of this study, one real kind of value out of the study, and one thing we really want to encourage jurisdictions is actually collect the data to know whether you're even having those challenges in the first place.
We have time for maybe one more. What was the ratio for male and female, and were the risk factors similar across the two genders?
Oh boy, I can't remember, Jen. We didn't look at gender differences and risk factors. That doesn't mean that we can't. We used gender as a control variable. We controlled for gender and race, ethnicity in all of our analyses. But the ratio is generally about what you would expect. I think that it was 25 to 30% girls across all the states, and the rest were boys.
To just add briefly to that, the reason that there was also a question about whether we paid attention to socioeconomic status. So we had very good indices of that. So SES and also gender, race, ethnicity. The reason that we controlled for that in the analysis is we wanted to make sure that our findings would generalize across gender, race, and socioeconomic groups. But there can and should be plenty of analyses that look at whether there are unique factors. In most of the literature, there's less unique for each of these characteristics than there is shared when it comes to risk factors for reoffending.
So we appreciate all of the enthusiasm and interest. There are a lot of questions. We're gonna be posting this webinar, which will obviously include the slides, on our respective websites. We'll see if we can have an opportunity to answer the questions. But want to encourage everyone to go look at the first brief that breaks down more information about the study and some of these initial findings on UMass's website. And as Jen described, the best is yet to come. We really feel like this protective factor analysis is unprecedented. It is going to make a very significant contribution to juvenile justice systems and service systems across the country. And so stay tuned, and we appreciate your interest in this important topic. Thank you all.